So hello everyone, and welcome to my session that I'm going to be providing a presentation on managing physical and psychological disabilities in a unionized environment, and it's a workplace model. And it's a model that actually, as an external consultant, that was engaged by an Ontario government ministry and their union. I'm very proud of the outcomes of this, so I'm very pleased to, and it's an honor to present this session to you today. My name is Viki Scott, and I'm the President and Principal Consultant of Scott and Associates Incorporated. We're a national-based firm, and we are known in the industry as a labor relations risk management or conflict risk management company. And as part of the services, we also have a lot of support. We provide a lot of support actually for employers in the area of occupational health and safety, and which lends to the disability management side. I believe my bio is on the website, and my contact is on the website if you need any further information. So just to do a really quick hit to put things into context, excuse me, there are current employer disability management models out in the market today, and they've been out there for a number of years, specifically NIDMAR, the National Institute of Disability Management and Research, and that's Canadian, and those Canadian standards have basically been recognized around the world. So as Canadians, we should be extremely proud of the model, and it is a union management model, and I believe it was incepted in probably the mid-'80s, so it's a long time ago. We have Canada's Health Corporate Health Model, the International Labor Organization modeling, and there's various collective agreements that also, since the 80s, have negotiated based on the NIDMAR model language that talks about union management committees as it relates to managing disability in the workplace environment. The key success, though, to any workplace joint model is cooperation, interaction amongst the management and labor and healthcare professionals at an early stage in the rehabilitation process, and that's very key with regards to developing a successful joint disability management return to work program. So I'm going to basically get into what the model was, and it's a collaborative approach to a design and delivery of an early and safe return to work and workplace accommodation program. And the organizations of which we facilitated the support with developing this program, their mantra or their slogan was building relationships and removing barriers. So since 2007, the Ontario Ministry of Children and Youth Services, Youth Justice Division, the Ministry, and the Ontario Public Service Employees Union work collaboratively in the development of a health and productivity program, workplace service delivery model. And this program has been developed to facilitate the early and safe return to work and workplace accommodation for ill, injured, or disabled employees regardless of causation. So there was a number of drivers for the program that were established, and the management perspective, and actually the union perspective, when you go through these, were pretty much the same. They were identified separately. So as a consultant, the primary consultant to this project, we met with the management group and we met with the union group first to determine, what would be the drivers that they would see as it related to managing disability in the workplace. And the need for the management perspective was to create an accommodation process that was fair, equitable, and defendable, develop strategies for cost avoidance and cost containment, develop a user-friendly toolkit for managers to better manage accommodations more effectively by building a better working relationship with the union, and incorporate and streamline all the existing programs and devise a process for consistency and ease of use. So the Ontario government had a lot of policies and procedures of which were overwhelming for I call it a correctional facility or a prison-based environment. And how disability was being managed in the workplace pre this was through a grievance procedure, rights-based. The union basically wanted their perspective. Their drivers were to protect the health and safety of all bargaining unit members in the workplace, minimizing the impact of accommodations on other bargaining unit members, proactively ensuring that the members' rights were being protected when requesting an accommodation, reducing the resource impact of unnecessary grievances, and more effectively serve the membership by building a better working relationship with the employer. They may have said it a little differently, But at the end of the day, we identified the common ground was they wanted an improved workplace program. So we did some benchmarking, and there's a number of universal models. The International Labor Organization has one. They even have a definition of disability management and what the joint program looks like. Broader public sector unions such as OPSU and QP, other jurisdictions we looked at in BC and Alberta, and the private sector with regards to identifying benchmark comparators. So the model, basically, and this was a consensus-based approach with regards to the parties. So they had a joint committee that met very regularly, and they had subcommittees, which they would bring in subject matter experts in developing the program and developing the standardized training for implementation, the tools, the templates. So we built consensus on the guiding principles of the model, which is to utilize an interest-based decision-making approach. Employee may choose to have representation at any stage of the plan and development. There's an assurance of confidentiality at all stages. It had to be collaborative-based, and health and safety must not be waived. So that was a consensus that they built on, and that's the fundamental pieces that basically created this program. So the primary members of the workplace model, and it's a committee, every facility in the province of Ontario that have young offenders and adult offenders are all separate. There's a workplace committee. And the workplace committee has trained 40 hours of training that's delivered. It was developed and delivered by a union and management team. And so there's subject matter advisors is what they're referred to in each facility. And there's a minimum 2 employer reps and 2 union reps with this specialized training. So they're available 24/7 to the workforce. So the committee would have an automatic union and management subject matter expert. The employee would be there, and the employee's manager, and then a union steward was there for power balancing. The union representative or the union subject matter advisor is not there representing the union, they're representing the program. So for power balancing, there's an added union steward sitting there. Secondary members, those that are internal to the organization would be union corporate resources. There's corporate human resources through the Ontario government. There's human resources consultants, and then there's the union regional staff representation. So again, they're balanced between management and employer internal resources. So there could be, the secondary members could be WSIB, any paramedical, any ergonomic specialist, insurance carriers, human rights commission human rights specialists, employee assistance programs, etc. So those are the external resources that the committee would access on a need-by-need basis. What's interesting, since we started the program, there hasn't been a need for an external functional abilities evaluation or external independent medical evaluation, which are, as we all know, are extremely costly. So they developed a 7-step program. So the entire program is on basically 3 pieces of paper. That's about it. And from there's a whole bunch of stuff behind it, but it's a model that they've framed in all their little offices and the work site, etc. So basically the 7-step for managing the process is identifying the need for accommodation. What does that look like? Do they need to be at home? Are they at work? Is it gradual, etc.? Obtain information. The subject matter advisors meet to discuss the case. They hold a meeting, and they create a plan, and they've developed a standardized plan. They implement the plan, and they review the plan as regularly as it's required according to medical. Then they do the follow-up, and they review, and then they close the file. They develop 7 forms, and they're consistent across government. They have, an officer representation document. So if somebody waives representation, then it's fine, but they do not encourage the waiving of union representation at these meetings. There's a fitness for work document, which this is where the removal of having to need third-party assessments, because they've given a longer form to the medical or the primary treating practitioner, and they complete it. And it's more information that the doctor can complete, or the nurse practitioner, or the Aboriginal healer. in support of the return to work. Then they have a plan developed, which is standardized, and health and safety is always there. It's always on the forefront, especially in I refer to as a prison environment. Then they have a notes document where they share. That's a shared drive between the subject matter experts. Then they have a provincial best practice accommodation tracking database. It's only accessible through the subject matter experts. Then they have a case tracking database, which we take a look at the end of the year. We take a look at indicators of types, duration, severity, etc. And then what's very interesting, we have a grievance tracking database. Any grievances that arise out of accommodation, we take a look at. And right now, there's none. When we went in there was thousands, but right now, since this program has been instituted, no grievances associated with disability have been initiated. So the measurable outcomes, what we've seen are reduction in grievances associated with workplace accommodation. I'm actually extremely proud of them on that front. Any costs associated with sickness, absence, and attendance has been reduced. Workplace accommodation requests have been reduced because they get ahead of it. There's a preventative side where I have a problem. How can I help you? Basically, the two pieces of conversation at the very beginning. So we try to keep people at work. And even if it's a soft tissue issue, if it's somebody that just needs a break from a certain part of the facility, then accommodation. They don't necessarily have to leave work. We don't want them leaving work unless it's necessary. Any costs associated with third-party intervention like independent medicals, FAEs, there's been no cost there. Costs associated with recruitment and replacement costs have reduced significantly because we have to replace a correctional officer. Fortunately, prisoners don't take care of themselves well right now, so there's an additional cost, and an additional cost they have to be trained, and they have to go through an academy just like a police officer. So costs associated with recruitment and replacement have reduced significantly. And costs associated with other areas of conflict like labor management relations, health, and safety have also reduced because the interest-based problem-solving approach that they've adopted through this program has now been basically patterned in other areas of joint committees. Understandable. The measurable outcomes that we've identified to date is that the program formally has been recognized in the Correctional Services Collective Agreement since 2013. The program is formally recognized in the Ontario Public Service Collective Agreement in 2015, so it's across government now. The program was adopted by the Federal Correctional Services, and we're in conversations with the federal government as this program model going across their federal system. The program was nominated for the Amethyst Award, which is the highest level of accolade anyone can receive in the Ontario government, and it was the first time that the union was also nominated. So we started in a combative environment and came back with sharing a very significant accolade from the government. They have established a community of practice. They just had their 10th year anniversary this year, all virtual, and so all the subject matter experts from across Ontario collect, and the cost is jointly shared, union and employer, and they basically have they retrain the new generation of subject matter experts, but the last 3 years we've been working on how to manage or best manage those individuals presenting with psychological stress issues or occupational stress injuries. And they're the recent recipient of the Ontario Government Pinnacle Award, which is another significant accolade in their favor. So thank you.